All right, here we go. About to go live here. All right, so well, my name is Dr. Philip Williams. I'm an orthopedic surgeon specializing in sports medicine. Um, I treat athletes of all competitive types. I focus on injuries of the shoulder, hip, and knee. And I typically try to do this about once a week to answer any questions about sports medicine, injuries in general, and try to answer just general questions and talk about ways to improve yourself and recover from injury, recover from surgery, and answer any lingering questions. I'm practicing in Houston, Texas right now. I had a day of operating today that I just finished up, worked on a couple knees and fixed a couple meniscuses as well as ACL. I typically focus on ACL, shoulder, and hip injuries, as well as cartilage injuries. And just want to start things off. Thank you for joining. We'll wait for a couple more people to join before we get started. But again, thanks for coming in. Typically do this once a week and try to answer any questions you have about sports medicine because that's my specialty here. And if you shoot me a question, I'll try to answer it the best I can. If I can't get to it because of just the sheer number of comments, just send me a DM and I'll be sure to try to get to it at some point. And so I'll just get started. Thank you everyone for joining. So first question, um, Eves Juju says, "Hey, I tore my meniscus and I'm starting PT soon. Should I stay away from sports?" So when you tear your meniscus, the recovery process can take about 4 months, depending on how the tear is fixed. If you have a repair of your meniscus, it can take about 4 to 6 months sometimes to recover from it. But the whole point, in my opinion, when I treat my patients is to get them back to playing sports. So the physical therapy should lead you into to sports eventually. Um, oh, Jorge says, "Hey, Dr. Williams did surgery on me. Hey, hopefully you're doing well. I'm sure you are, but glad to see you. Thanks for joining in." Um, CPON said, " 6 months post ACL and meniscus. Hopefully you're doing well." Manny says, "I maybe have sprained ACL. What do you recommend? My sports medicine doctor doesn't seem worried." So spraining your ACL is possible. It's not very common to sprain your ACL. Either you tear it or you don't. So usually when someone has an ACL injury, it is symptomatic with instability. And if your symptoms are instability and you can't really get back to your activities that you enjoy, usually that's my indication to treat a patient with surgery if they have instability symptoms, swelling, and problems with their daily life, or they want to get to a sport that they can't do. Um, so I'm just skipping around here. And I'm going to keep, so I focus on shoulder, hip, and knee. So sometimes if you ask me a question about other body parts, I might not answer it because that's not my specialty. Uh, so user long number says, "I sublux my shoulder. Why I wanted to get better." So subluxing your shoulder means that it comes partially out. So some people have loose shoulders that can dislocate or basically come partially out of the socket. And the way we treat that is with physical therapy, focusing on strengthening the muscles and areas around the shoulder that are responsible for stabilizing the shoulder. So shoulder stabilization stretches is the key for subluxed shoulder. So Josh says left knee keeps clicking. What does that mean? Clicking in the knee can be from a variety of things. So typically, we do not worry as orthopedic surgeons about general clicking in the knee unless it's painful. Clicking in the knee is usually due to tracking of the patella or the kneecap. Sometimes it doesn't track properly. If you think of it as a train going down a track, sometimes your tracks aren't aligned properly, and that causes the um, patella or the kneecap and knee to click at times. Um, So, just skipping around here to other questions. Uh, Sorry, I just missed your question. Uh, Jazz says patella knee tendon pain after ACL surgery. Been 11 months since surgery. So the highest amount of complication, or the most common complication after ACL surgery, especially if you have a patella tendon ACL or a bone patella ACL reconstruction, is anterior knee pain. And that's because you have to take a part of the patella bone in order to reconstruct the ACL, and that can cause pain post-operatively. And it's very common to have that post-op anterior knee pain after ACL, and that can take a long time to recover from. So Austin Martinez says left metatarsal Jones fracture. How long am I out? I'm 15 years old. So a Jones fracture of the foot is basically your fifth toe, and if you have this particular type of fracture, it's called a Jones fracture, named after the doctor who invented it or found it. And a Jones fracture is important because it is a fracture that does not usually heal without surgery. And typically, athletes get this because of the stresses that they put on their foot, but it is well treated with a surgery that stabilizes the fracture. And typically, most athletes can go back to playing their sport within 6 weeks after this surgery. And if I miss your question, just send me a DM, please. Um, So Keenan says, Doc, I'm getting a quad graft ACL meniscus repair on Tuesday. Any tips for recovery? So I typically do quad ACL reconstructions, which just sounds like what you're doing and what you're getting. So good luck on your surgery. But the biggest thing I would say for anyone getting ACL surgery is to focus on getting your range of motion back, and trying to get your range of motion back as quickly and as safely as possible, because that's the key to preventing the knee from getting stiff, because that can sometimes be the most troublesome problem with these surgeries is stiffness after surgery. So work on getting a range of motion back, then you get your strength back gradually, and just focus on the physical therapy protocol, and I'm sure you'll do well. But good luck. So Brendan Valier says, I'm 21 years old, post-op from a rotator cuff labrum repair, still have pain. Is this normal? The typical time frame for a recovery after a rotator cuff, in general, I would say on average, people feel better around the 6 month time period. But it's been shown in research that it can take up to 9 to 12 months for some people to recover from a rotator cuff, specifically in terms of their pain and their functional status. If you had a labrum repair on top of that, which is kind of a big injury to have a rotator cuff and labrum repair, that would probably extend the amount of time it would take to feel better after surgery. So I would say stick in there, stick with it, keep doing physical therapy, keep doing exercises, and hopefully things will turn around. Again, if I miss your question, send me a DM. I try to get to a lot of questions, so try to stay around, and I might get to your question even if I get to it a long after time, long after you actually send me the comment. Um, so. Um, So Issei Rodriguez says, if a patient has imaging already, do you review them or do you rely on physical exam to have a differential diagnosis? Excellent question. So for orthopedic surgeons, we pretty much always get x-rays at minimum when we see a patient, and we rely on the history of the injury or the history of whatever they're complaining of, the physical exam, and the imaging. So I would say we rely on everything in terms of what we get from the patient. And look at the images ourselves. We are able to read x-rays, MRIs, CAT scans, and pretty much most imaging modality. Of course, we use radiologists sometimes to help to interpret a lot of the images that we see, but we are pretty good at reading and interpreting any type of image of the musculoskeletal system. Um, so Carlos says, Oh, I missed the question. Sorry. Scarlett says, after golf, my forearm has a sharp pain when twisting my arm outward. I'm 26 years old. A common issue with golfers, particularly something called golfer's elbow. So golfer's elbow is the inner part of your elbow, also known as the medial epicondyle. And so the term for pain, kind of in the forearm and in the elbow, especially with golfers, it's called golfer's elbow, and it's basically tennis elbow, but for golfers, which is a different part of the elbow. And commonly, that's treated with physical therapy, working on stretching the forearm and the wrist to prevent it from happening. So Mindy V says medial tibial plateau, non-displaced fracture with lateral patellar fissure. Thought is healed. What surgery time? So hard to know what you're asking here. Sounds like you've had a tibial plateau fracture with a injury to your patella too as well. So medial plateau fracture. So you're talking about basically you're fractured the top of your bone, the top of your tibial bone around your knee, and sometimes that can be fixed with surgery depending on how bad the injury is. But I would say in general, if you have a tibial plateau fracture that needs to be fixed, that is at least in general usually about 6 weeks of time that you need to be off of your knee once it's fixed, because you don't want to bear weight after a tibial plateau fracture, because that can cause the fracture to collapse after it's fixed. So it generally takes a long time for weight bearing after tibial plateau fracture, 6 to 8 weeks. So Mark Schmidt says medial meniscus posterior root tear fixable without surgery. Unfortunately, meniscus root tears are not fixable without surgery, and they are a very serious meniscus injury because the root is literally where the meniscus docks into the tibia. So once you tear the root, it can cause the meniscus to start to basically float away from the knee. And once you have a meniscus that does not float or does not stay in the knee, you have degeneration of the cartilage in the knee and early arthritis. So meniscus root tears, unfortunately, are tears that need to be fixed with surgery. But usually surgery does a great job in terms of getting a patient back to their activities, as long as it's done correctly and in a timely fashion. So I'm going to skip around here. If I missed your question, send me a DM. So what do you recommend per strain? So MJ says, why did PRP injections not help my rotator cuff tear? So excellent question. PRP is platelet-rich plasma, which is blood that we take from you, and we can concentrate those platelets in a centrifuge, and we inject those platelets back into the injured area. And the thought is that this injection is concentrated, and is concentrated with growth factors and other stem cell-like factors. They're not stem cells, but they are thought to improve healing and improve the pain profile of the patient. The problem is that these things do not necessarily heal injuries, especially of the tendon. There has been no conclusive evidence that shows that PRP has any real healing in the rotator cuff. And so I would say the reason why a PRP injection did not heal your rotator cuff is that there is no evidence that it heals a rotator cuff. So Mustafa Ahmed said, I had tibia fibula surgery 6 weeks ago. How long will it take to be able to drive? So they've done studies on driving after lower extremity injuries, especially with ankle fractures, and they found that it takes about 10 weeks for the braking time to normalize after a lower extremity fracture surgery. And the braking time is obviously the most important part of the driving that you want to be aware of, because that's the safety factor of it. So in general, I tell my patients about 8 to 10 weeks after lower extremity injury to go back to driving safely. Cindy says, best treatment for runner's knee. Son has pain behind kneecap when running. So runner's knee is called in the medical terminology patellofemoral syndrome. The patella is the kneecap and the femur is the thigh bone. The way we treat this is with stretching and strengthening the proper muscles. The muscles that need to be strengthened is specifically the vastus medialis obliquus, which is the inner quad muscle, and you need to stretch out the the hamstrings, and also need to loosen up the iliotibial band on the outside. So stretching and strengthening is basically the way to get through patellofemoral syndrome. Um, John Lash says, thoracic outlet syndrome surgery. Give me your rundown as a baseball player, recovery time and protocol. Asking a lot here from me. I don't do that surgery. So thoracic outlet syndrome is a surgery that is for people who have either nerve findings that are numbness and tingling in their hand, or vascular issues in their hand. And it's usually from some compression of a nerve or vessel around their neck. And it's treated with surgery sometimes in cases that don't get better physical therapy. And so typically the recovery timeline, I would say, is on the order of 10 to 12 weeks is my my ballpark answer for that. So the Colton Ked says MPFL reconstructed. When can I expect to be 100%? So I would say in general, it would take about 6 months to get to feeling confident to run or play sports after a MPFL reconstruction, but that depends on the physical therapy that you do. And I see that my own physical therapist is watching on Instagram. Thanks, Caleb. Caleb is my physical therapist that I used when I tore my Achilles 3 years ago now, and he's excellent. So everyone go follow Caleb West right now. So I'm going to skip around again. If I miss your question, just send me a DM. I have like less than 5 minutes left here, I think. So Lucas says, how many years of schooling did it take to get where you are? So 4 years of college, 4 years of med school, 5 years of orthopedic residency, and 1 year of fellowship training. So you can, if you add that up, that's how long it took me to get here, practicing orthopedic surgery, but it's worth it. Sean Finnegan says, have you used Arthrex before? I used to work for them. Well, have I used Arthrex? Well, the Arthrex people here know that I pretty much use Arthrex most of the time, but that's what I do for most of my cases right now. So I'm going to skip around here for a second. Sandeep Singh says, I'm going for ACL surgery in a week. Do you have any tips post-op? So I've answered this question a couple times. So the basic question that you need to do, in my opinion, for ACL surgery before and after surgery is work on your range of motion. Make sure you get your full extension, full flexion as soon as possible. And that is one of the best things that you could do. So I'm going to skip around. Sorry. I crashed my sim. I'm trying to find a good question here that is something that I actually treat. Oh, great. So M. Scott says, what are your thoughts on this new BEAR procedure orthos are doing? So BEAR, it's a great question. BEAR is Bridge Enhanced ACL Repair. So the company actually is this company that is using this implant that goes into your knee to enhance the healing of an ACL when you try to repair it. So traditionally, ACLs have not been repaired because we thought that the ACL cannot heal once it's torn. But they've been doing studies that have found that if you provide the correct conditions within the knee, there is a possibility that the ACL can repair itself. And so the bear is basically this implant that you put inside the knee, and you put it around a torn ACL, and it can help the ACL repair. They've been doing multiple studies on this in humans and in patients, and they found some good results in a lot of studies. And I actually think it is compelling to use in certain situations. It does have a higher chance of re-tear in terms of ACL repair with a Bayer versus ACL reconstruction. It's about 10% re-tear rate versus 3% for a reconstruction. But I think in the proper patient, a Bayer ACL is probably a very good option that is less minimally it's a more minimally invasive procedure, and it has some good results in people who do not do highly competitive activities. And I think there's going to be more and more research that shows that it is a good option to do the ACL repair instead of doing a full-on ACL reconstruction. So great question. Thanks, M. Scott 63. So, all right, I have 5 more minutes here. What brand? Sorry, I'm just gonna. Please, Doc. What? So Kyler Meister says, any tips to help a buckle fracture near the wrist heal faster? So buckle fracture is basically a fracture of the wrist that occurs usually younger. Well, it happens in younger people who have more flexible bones, and it's because their bones are still growing. Their bones are more rubbery than adults, and buckle fractures take about 4 to 6 weeks to heal. Best thing you can do is just stay off of it, protect it, and have good nutrition. Ellie Mazzari says, how long does it take to recover from an ACL meniscus surgery? Also, what good workouts to do? So I would say in general, it takes about 9 months to really recover fully for a ACL and meniscus surgery. And typically the physical therapy includes getting your range of motion back, getting your strength back, and getting your dynamic ability back. So I'm not a physical therapist, so I can't necessarily tell you what good workouts to do, but it takes about 9 months to basically return from ACL reconstruction or ACL surgery. Yeah. Yes, I went to Harvard Medical School. Sammy says, my brother had a Latarjet procedure years ago, college wrestler. So Latarjet procedure is a procedure that helps is basically for stabilization of the shoulder after a shoulder dislocation or multiple dislocations. Usually we do a Latarjet procedure when you've had multiple dislocations and you've had bone loss in your glenoid or your socket in your shoulder. And it's a very good operation to improve the stabilization of the shoulder. And patients do well and return to sport at a high level. So Caleb West, my personal physical therapist, says, are there any other criteria you look for patients to meet prior to ACL reconstruction? You mentioned full range of motion is ideal. I would say if a patient needs surgery, I do not have many other criteria other than I want them to try to get as much motion as possible. And that's because if you don't get the motion back, it is going to be a long recovery trying to get motion back after surgery because they're only going to get more stiff. So range of motion is ideal, but I don't necessarily preclude them from having surgery if they are still not getting their motion back. M. Scott 63 says, what's your average return for ACL, 9 months or 12 months? So it's a great question. I would say 9 months is the average that I would look for, but I really prefer patients to feel comfortable, and I want to be comfortable with them going back to sports. So it could be anywhere from 9 to 12 months for a return to play. So Reese Sanders 12 says, do you have any X-ray techs? Yes, I work with X-ray techs all the time, especially if I'm doing a procedure that requires a lot of fluoroscopy during the procedure. But we also have X-ray techs in the clinic, and we get x-rays on almost every patient that we see in clinic. So x-ray techs are very important to the clinic flow in an orthopedic office. Um, so so X says, I got meniscus repair in January. I'm 100%. Will I still be able to join the military? So excellent question. So meniscus repair surgery is a very good procedure, and patients do very well. It takes about 6 months to recover from. So it sounds like you were outside of that time period. And as long as you have your strength back and you are able to run and jump, usually I would say in general, my patients are able to go back to their sports around the 8 month mark. And so the military, I would imagine, would have similar parameters to going back to serve. So good luck with that, and thank you for their service. Um, so I have 1 more minute. So I'm going to answer 2 more questions. Sam Kratz says, I just had my labrum repaired yesterday. What should I expect for recovery time? So hopefully you're feeling better. In general, it takes about 4 months to recover from a labrum repair surgery, as long as it is a pretty straightforward repair. um, so I have one more question that I'll answer. Um, I, I, so Hi says, a Liz Frank injury. I had 2 surgeries already. What do I do now? It's been a year and a half. So unfortunately, I'm not a foot and ankle surgeon, so I can't necessarily go into detail about a Liz Frank surgery. So Liz Frank is the strongest ligament in the foot, and when you tear it, you have an unstable foot, and it typically needs surgery if it continues to be painful or it's severe. So I would say hopefully you get treated by a very specialized foot and ankle surgeon for any revision surgery. So hopefully you do better. So I'm going to answer one more question. So B. Lackey says, what is your typical timeline for tibial plateau RAF to regain full range of motion or up to 120 degrees? Great question. So I don't perform tibial plateau fracture surgery anymore. That's my trauma colleagues who do that. But in general, we want range of motion 90 to 120 or so, probably by week 6 or so after surgery. It's aggressive, but honestly, within 3 to 4 weeks is probably ideal to get that range of motion back, because if not, the knee gets very stiff. So again, if I missed your question, please send me a DM. I'm going to answer one more question, then I have to go. So Jake 102, hey Doc, I'm going to join your live to ask questions about my class. Sure, I'm happy to answer questions another time. We can do it another time. How long is recovery for a slap tear? First of all, so I'll answer this question. Last question I'm answering. Sorry, and I have to go. I appreciate you joining. So Riley said, I partially tore my LCL 7 months ago, but still get pain if I do anything, even after PT. Any tips? So I would just say, in general, if you have an issue that doesn't get better after several months of physical therapy, and you have it evaluated, I would get a second opinion by an orthopedic surgeon, have another imaging session probably to make sure that the injury is accurate and the diagnosis is accurate. There might be other associated injuries that have not been addressed. So that would be my advice for someone like that. But thank you for joining me. Sorry, I have to leave this live session with some of you hanging here. Again, if you don't get your question answered, just send me a DM and I'll try to answer it. Thank you. Quick answers for some of these that are still here on Instagram. ACL functional brace or no brace. So I use a functional brace only if a patient has less than 90% strength in their affected knee. After return to play testing at about the 8 to 9 month mark after ACL. But I really don't think a brace is necessary if you have appropriate strength in your knee. And so, Caleb, last question I'm answering. So, Caleb, I actually get more sleep now. I have a Whoop just like you, and it helps me track my recovery too. So, thanks a lot for joining. And I appreciate everybody for tuning in. And I'll talk to you another time. Take care. Bye.